my fellow health professionals, colleagues, and fellow citizens of the world. I am Dr. Mohammad Adil from United Kingdom. I am fellow of the Royal College of Surgeons of UK, and I've been working as a consultant surgeon with 30 years of unblemished medical record while working for the National Health Services of the UK. This is the time to refresh our medical ethics and the code of conduct, which are mandatory requisite for our day-to-day practice as a medical professional. I believe on the Hippocratic Oath, which says, first, do no harm, established by Greek physicians before taking up their first job. I believe on the Nuremberg Code, which is a piece of medical ethics with fully informed consent in the wake of Nazis' atrocities for carrying out inhuman, mostly fatal procedures on the living human subjects. And I believe on Helsinki's declaration, which is piece of medical principles and ethics for the health professionals before carrying out experimentation on the human subjects with fully informed consent and formal approval from the ethical committee established in 1964 by World Medical Association, updated in 2014. And I believe on my Geneva Declaration, which says, I will attend my own health, well-being, and abilities to provide the highest standard of medical treatment, and I will not use my knowledge to violate human rights and civil liberties. I believe on the robust scientific debate between the health professionals before starting any new treatment. And I believe on total bodily autonomy of all the human bodies. And I believe with face-to-face appointment with my patients to discuss about the management plan and the future strategies. Unfortunately, there has been serious violation of the human rights and the civil liberties and the medical ethics for the last 2.5 years, right from early 2020, when unprecedented lockdown was imposed on the public with extraordinary restrictions to the public personal and private lives, which resulted in severe damage to their freedom, liberty, economy, health, and well-being. There has been thousands of unnecessary deaths in nursing and care homes and in the private homes of the public because of lack of medical facilities, isolation, dehydration, and neglect. These precious lives could have been saved by expert hands within the hospital environment. Secondly, there has been improper, unethical rollout of messenger RNA vaccination, which was totally unlicensed and experimental, to the human subject without their formal consent, with full indemnity to the pharmaceutical companies and the medical establishment. We have seen serious damages and deaths happening because of messenger RNA vaccination without fully informed consent, right from embryonic life to the elderly patients with embryonic deaths, abortions, endothelial damage, cardiovascular damage, thrombosis, myocarditis, sudden cardiac arrest, respiratory failure, clots in lungs and brain resulting into strokes, paralysis, and recently Guillain-Barré syndrome and dementia has been reported from different parts of the world after studying extensive literature, research, and publications. We, the health professionals across the world, should abide by our medical ethics and code of conduct, not to harm our patients. And we must raise this issue to the higher authorities to control these unnecessary damages to the public and for the safety of our patients and their well-being. We are working day and night with all honesty and sincerity, and we will do our best with our skills and abilities to all our patients, regardless of any color, race, individuality, belief, or religion. This is my message to the higher authorities. And lastly, I would request to the higher authorities to compensate to the people who have been seriously damaged with the vaccination and stop this unnecessary vaccination to safeguard other public from the serious injuries. Many thanks. Bye for now.